Welcome to Module 11 of the PSW NACC exam. In this module, we'll be going through various questions on cognitive and mental health issues. So we're starting right off with question 1. In the brain, the highest functions take place in the following area. A. Frontal lobe. B. Cerebral cortex. C. Hypothalamus. D. The frontal lobe is part of the cerebral cortex and it is involved in functions like problem solving, decision making, and motor control. The cerebral cortex is the outermost layer of the brain and it is responsible for the highest functions, including reasoning, memory, thoughts, perception, and voluntary muscle control. The hypothalamus regulates vital bodily functions like temperature, hunger, hormonal balance, but it is not responsible for the highest cognitive functions. The amygdala plays a key role in emotion processing, particularly fear and pleasure, but it is not involved in cognitive functions. So with respect to the option, the highest function takes place in option B, which is the cerebral cortex. It is involved in complex mental processes and it is divided into different lobes. Question 2. Which of the following statements is not correct for describing delirium? A. It is an emergency. B. It is a temporary state of confusion. C. It should be ignored as it is a natural part of aging. D. It is often a reaction to medication or infection. Delirium is considered an emergency because it is a sign of a serious medical condition that needs immediate treatment. In option B, delirium is indeed a temporary state of confusion which can develop suddenly and fluctuate in severity. Delirium is, however, not a natural part of aging and it should never be ignored. It is basically a temporary acute state of confusion that often results from underlying health conditions like infection, medical reaction, or even other complex health problems. It is a medical emergency that requires prompt attention because it can indicate a serious health condition. In option D, delirium is often triggered by factors like medication side effects or infections, especially in older adults. The question says which of the following statement is not correct for describing delirium. So that would be option C. Delirium should never be ignored because it is not a natural part of aging. It is a state of confusion that results from underlying medical conditions like infections, medication reaction, or other complex health problems. Question 3. The reason that an older woman might feel ashamed of her sexual feelings include all of the following except that she A. was promiscuous when she was younger, B. has internalized society's expectation of older women and sexuality, C. is feeling depressed about her earlier life, D. has regressed to an earlier time when she was happily married. Feeling ashamed of sexual feelings is more commonly linked to societal expectations and personal struggles rather than past behavior that may be seen as promiscuous. Societal norms often create a sense of shame in older individuals about their sexual feelings, especially for women who may be expected to conform to certain roles as they age. If we take a look at the other options B, C, and D, they are more directly related to emotional or psychological responses that could lead to feelings of shame. In option B, societal norms can make older women feel that they are no longer supposed to express sexual desire, leading to feelings of shame or guilt. In option C, depression can cause individuals to feel shame or regret about their past, including their sexual experiences. In option D, this could suggest an emotional struggle with the passage of time and changes in life circumstances, and this might affect how a person views their sexuality. With respect to the question, the option that is the exception here is option A. Question 4. Mr. Johnson is very confused. He likes to have a cigarette after lunch. You should A. Take him to the smoking room. B. Supervise his smoking. C. Respect his right to smoke anytime he wants. D. Tell him he cannot smoke. Although option A may be part of the process, it does not address the supervision that will be needed to ensure Mr. Johnson's safety while smoking. It is important to respect the client's preference and habits. However, safety is a top priority, especially for clients who may be confused or disoriented. So option B, supervising Mr. Johnson's smoking, ensures that he is able to engage in these activities safely, because confusion may increase the risk of accidents such as forgetting to put out the cigarette or smoking in an unsafe environment. For option C, while it is important to respect autonomy, a confused client may need additional oversight to prevent harm. And option D disregards Mr. John's preferences and may even cause frustration. So it is better to accommodate his needs with appropriate supervision. So we'll be going with option B. You should supervise his smoking to ensure that he does not engage in acts that could put him in danger. Question 5. At what age is dementia common? A. After 65 years of age. B. Between 40 to 50 years of age. C. Between 20 to 30 years of age. D. Between 50 to 60 years of age. Dementia, including Alzheimer's disease, is commonly seen in individuals over the age of 65. The risk of developing dementia increases with age, and this is more prevalent in older adults. While early onset dementia can occur in individuals younger than 65, it is much less common. So our answer here is option A. Dementia is common after the age of 65. Question 6. Molly says giant spiders are climbing the wall and she is terrified, but you see nothing on the wall. As a PSW, what do you do? A. Pretend you see the insects. B. Offer Molly comfort and report it to the nurse. C. Leave Molly alone and call for help. D. Insist that she is seeing things. Option A is not advisable because this can reinforce the hallucination and cause further distress. When a client experiences hallucinations or delusions, as Molly is having one in this scenario, it is important to validate her feelings without reinforcing the hallucination. Offering comfort and reassurance, like saying things like, "I understand that you're feeling scared," will help to provide emotional support. It is also essential to report the situation to the nurse or healthcare provider because this could indicate a medical issue like a reaction to medication, infection, or even a worsening of a mental health condition. For option C, while seeking help is important, leaving Molly alone without comfort may increase her anxiety. And in option D, denying her experience may make her feel unsupported and cause confusion or distress. So as a PSW in this scenario, what you should do is offer Molly comfort and report it to the nurse. Question 7. Failure to provide for oneself through inattention or dissipation may be attributed to A. Self-neglect. B. Self-care deficits. C. Difficulty in managing ADLs. D. All of the above. If we take a look at each of the terms in the options A to C, Each of them refers to a situation where an individual is unable to adequately care for themselves, but they all have slightly different nuances. So in option A, self-neglect refers to the failure to provide for one's own basic needs, such as hygiene, nutrition, or safety, and this is due to inattention or dissipation. For option B, self-care deficit is the inability or difficulty in performing activities of daily living, which can include eating, bathing, dressing, and this is due to physical or mental health challenges. For option C, difficulty in managing ADLs describes the challenges a person faces in managing their daily activities, like dressing, feeding, and personal hygiene, and this can be related to a physical decline or a cognitive decline. So, if we take a look at all the options, all of them are attributed to the question we have. The failure to provide for oneself through inattention or dissipation may be attributed to either self-neglect, self-care deficits, or difficulty in managing ADLs. So the answer is option D, all of the above. Question 8. Dementia is always caused by Alzheimer's disease, true or false? The answer here is false because dementia is a general term used to describe a decline in cognitive abilities, and it is severe enough to interfere with daily life. Alzheimer's disease is the most common cause of dementia. However, it is not the only cause. There are other conditions like vascular dementia, Lewy body dementia, frontotemporal dementia, and Parkinson's disease. All this can cause dementia. So the causes of dementia can vary, and each type may have different symptoms and progression. So dementia is not always caused by Alzheimer's disease. Question 9. What layer surrounds the brain? A. Cerebrospinal fluid. B. Pia mater. C. Dura mater. D. Meninges. We'll be going with option D. The meninges is a protective covering that surrounds the brain and spinal cord. It consists of 3 layers, which are the dura mater, the arachnoid mater, and the pia mater. The dura mater is the outermost thick layer, the arachnoid mater is the middle web-like layer, and the pia mater is the innermost layer that closely adheres to the brain and the spinal cord. So, the layer that surrounds the brain is known as the meninges. And that is option D. Question 10. Diana loves to eat and she always eats with her family. You noticed that she is always in the washroom and has food packets under her bed. What do you expect she has? A. Phobic disorder. B. Anorexia nervosa. C. Bulimia. D. Obsessive compulsive disorder. A phobic disorder is an intense irrational fear of certain objects or situations. Anorexia nervosa is an eating disorder that involves extreme restriction of food intake and an intense fear of gaining weight. Bulimia is an eating disorder characterized by binge eating, that is, eating large amounts of food in a short period, followed by purging behaviors like vomiting or excessive use of laxatives to prevent weight gain. Obsessive compulsive disorder involves repetitive, intrusive thoughts and behaviors, but it does not relate to the eating or purging behaviors seen in the scenario. Diana's behavior of frequently being in the washroom and having food packets hidden under her bed suggests that she may be engaging in secretive eating and purging behaviors, and this is a sign of bulimia. That is option C. Question 11. How many stages of dementia exists? A. 1. B. 3. C. 5. D. 7. We'll be going with option D, that is 7. There are 7 stages of dementia and they are in 3 categories. First category is the early stage, which is from stage 1 to stage 4. The middle stage is from stage 5 into stage 6, and the late stage is from stage 6 into stage 7. These stages ranges from absence of cognitive decline to severe cognitive impairment. So in stage 1, there is no apparent sign, there is no memory problems, there is no cognitive decline. In stage 2, there is occasional forgetfulness, but it does not impact on daily activities. In stage 3, which is the mild cognitive decline, there is noticeable memory problems and difficulty with some tasks. In stage 4, there is difficulty with complex tasks such as managing finances. By stage 5, which is the moderately severe cognitive decline, the person requires assistance for daily activities and they often forget their personal information. In stage 6, there is the loss of ability to perform basic activities of daily living and they often experience disorientation. And then in stage 7, which is the very severe cognitive decline, there is loss of speech, loss of motor function, and inability to perform any self-care. So these are the stages of dementia. There are 7 of them. Question 12. What is meant by a responsive behavior? A. How a PSW must respond to a resident. B. When a patient wanders around the unit. C. Challenging behaviors that may be a response to physical discomfort. D. When a resident responds appropriately in a social situation. Option A refers to how a personal support worker interacts with a resident, but it does not describe the resident's behavior. In option B, while wandering may be a type of responsive behavior, it is just one example, but it is not the definition of responsive behavior itself. Responsive behaviors are challenging actions or reactions that are exhibited by individuals, and this is often in response to physical discomfort, emotional distress, or unmet needs. These behaviors can include agitation, wandering, aggression, verbal outbursts, or resistance to care. They are commonly seen in individuals with conditions like dementia, and understanding these types of behaviors will help caregivers to address the root issue or the root cause, and this can be due to pain, fear, or confusion. In option D, this describes appropriate behavior in a social context, so it is not a responsive behavior. So with respect to the question, the answer is option C. A responsive behavior is a challenging behavior that can be a response to physical discomforts. Question 13. Mr. Ken is very pleasant and easy to care for during the day shifts, but you observe that he is restless and swears at the staff during the evening hours. This is a sign of A. Delirium, B. Dementia, C. Sundowning, D. Depression. Delirium is a sudden onset of confusion that typically has an identifiable cause such as medication or infection. It, however, does not specifically occur in the evening. While dementia can cause confusion and behavioral changes, it does not particularly occur in the evening, like in the scenario we have. Sundowning is a phenomenon where individuals, especially those with dementia, experience an increase in confusion, agitation, and disruptive behaviors such as restlessness or swearing during the late afternoon or evening. This can be triggered by factors like fatigue, changes in the environment, or decreased sunlight. Depression can cause mood changes, but it is not linked to specific times of the day. So with respect to the scenario we were given, this action is a sign of sundowning, and that is option C. Question 14. What is a phobia? A. A phenomenon common in people with dementia. B. An unreasonable fear. C. A compulsion. D. A symptom of depression. While individuals with dementia may exhibit anxiety or fear, phobia is not specifically linked to dementia. A phobia is an intense, irrational, and excessive fear of a specific object, situation, or activity that is often out of proportion to the actual danger it poses. Phobias can be classified as a type of anxiety disorder, and they can significantly interfere with a person's daily life. A compulsion is a repetitive behavior or mental act that a person feels driven to perform, and this is often seen in conditions like obsessive-compulsive disorder. For option D, phobias are not a direct symptom of depression, although both of them can coexist in some individuals. So, a phobia, based on the options we are given, is an unreasonable or irrational fear of a specific object, situation, or activity. Phobias can usually be treated through methods like cognitive behavioral therapy or gradual exposure therapy. Question 15. Bipolar disorder is characterized by depression, delirium, and mania. True or false? For this, the answer is false. Bipolar disorder is characterized by extreme mood swings, and this can include both depressive episodes and mania. Delirium is not a characteristic of bipolar disorder. Delirium is an acute state of confusion and disorientation, and this is caused by medical conditions like infections or medication side effects. So, the answer is false. Bipolar disorder is not characterized by depression, delirium, or mania. So the answer is false because while bipolar disorder is characterized by depressive episodes and mania, it is not characterized by delirium. So this makes the whole statement false. Question 16. A lack of regard for moral or legal standards in the local culture or marked inability to get along with others or abide by societal laws is known as A. Narcissistic personality disorder. B. Borderline personality disorder. C. Antisocial personality disorder. D. Histrionic personality disorder. Narcissistic personality disorder involves an excessive sense of self-importance, need for admiration, and lack of empathy, but it does not involve a disregard for laws or social norms. Borderline personality disorder is characterized by emotional instability, fear of abandonment, impulsive behavior, and unstable relationships, but it does not have the chronic disregard for societal laws. Antisocial personality disorder is characterized by a persistent disregard for moral, social, and legal norms. There is also the tendency to violate the rights of others, including engaging in deceit, manipulation, or criminal behavior. Histrionic personality disorder involves excessive emotionality and attention-seeking behaviors. However, there is no disregard for laws or morals. So our answer here is option C. Antisocial personality disorder is also characterized by a lack of empathy, remorse, or guilt, and there is difficulty in forming meaningful relationships or conforming to societal laws and expectation. This disorder is often diagnosed in individuals who exhibit this behavior consistently from adolescence or from early adulthood. Question 17. The brain is connected to the spinal cord by the A. Cerebrum, B. Cerebellum, C. Cerebral cortex, D. Brainstem. The cerebrum is the largest part of the brain and it is responsible for voluntary actions sensory perception, and cognitive functions. The cerebellum manages balance, coordination, and fine motor control, but it is not involved in connecting the brain to the spinal cord. The cerebral cortex is the outer layer of the cerebrum, and it is involved in higher level functioning like thinking and decision making, but it is not a structural connection to the spinal cord. The brainstem connects the brain to the spinal cord and serves as a critical communication pathway. It controls many automatic functions that are essential for life, such as breathing, heart rate, and blood pressure. The brainstem consists of three parts: the midbrain, the pons, and the medulla oblongata. The midbrain plays a role in motor movements and auditory and visual processing. The pons relays information between the cerebrum and the cerebellum and assists in controlling breathing, while the medulla oblongata regulates vital functions like heart rate and respiration, and it is directly connected to the spinal cord. So our answer is option D. The brain is connected to the spinal cord by the brainstem. Question 18. What is the term for wandering behavior commonly seen in clients with dementia? A. Cognitive wandering. B. Exploratory walking. C. Elopement. D. Agitated pacing. Option A is not a standard term used to describe dementia-related wandering behavior. In option B, while this may describe curiosity-driven movements, it does not capture the disoriented or unsafe aspect of dementia-related wandering. In option C, elopement refers to the wandering behavior seen in clients with dementia when they leave a safe or supervised environment, and this is often driven by confusion, disorientation, or the desire to go home. It can pose serious safety risk if the individual enters unsafe areas or become lost. Agitated pacing refers to repetitive movements due to restlessness or anxiety, but this is different from purposeful wandering or attempts to leave a secure environment. So our answer is option C, elopement. This is the wandering behavior seen in clients with dementia. Question 19. Which of the following is an effective strategy for managing aggressive behavior in clients with dementia? A. Respond with firm commands to assert authority. B. Use gentle, calm communication and identify possible triggers. C. Ignore the aggression until the client calms down. D. Physically restrain the client to prevent harm. Option A may escalate aggression, as clients with dementia often respond negatively to authoritative or confrontational behavior. Managing aggression in clients with dementia requires a calm and empathetic approach. Gentle communication helps to de-escalate the situation while identifying and addressing the triggers. So you could identify that it is either due to pain, fear, or environmental factors, and this can prevent future incidents. In option C, ignoring aggressive behavior can compromise your safety, and it fails to address the underlying cause of the aggression. And in option D, physical restraint should be a last resort, used only if the client poses immediate danger to themselves or others, and it has to be in compliance with policies and guidelines. So, an effective strategy for managing an aggressive behavior in clients with dementia is option B, using gentle, calm communication and identifying the possible triggers. Question 20. Which of the following is the primary focus when providing care to a client with dementia? A. Correcting their misconceptions about reality. B. Supporting their safety, comfort, and dignity. C. Encouraging complete independence in daily tasks. D. Minimizing communication to avoid agitation. For this, we'll be going with option B. Providing care to clients with dementia emphasizes maintaining their safety, ensuring comfort, and treating them with dignity. Their needs often evolve around emotional support, security, and maintaining as much independence as possible within safe limits. This brings us to the end of the Module 12 video for the PSW NACC exam. Thank you for watching, and don't forget to like, comment, and share, and also hit the subscribe button so that you'll be notified when our next informative video will drop in. Thank you for watching, and I'll see you in the next one.